So hello friends, welcome back to my channel Medicine Hub 101. Today we'll talk about edema and its the clinical correlations. So we'll talk about the edema and clinical correlates about it. Okay. So first, what do we mean by edema? It's a very the familiar terms. I think hope all of you have heard the term edema. So what do we mean by edema basically? Okay. So when you're talking in terms of the edema, so most of all know it that what edema means basically we can classify in terms of accumulation of fluid within the tissue extravascularly. Try to understand the term. Whenever I am saying that edema means accumulation of excessive fluid where accumulation of excessive fluid in tissue. So when you are talking in terms of the accumulations of the fluid in tissue, definitely that will be the extravascularly. Now try to understand. For example, is the general circulation. If we see the volume of the blood that is getting increased, definitely we are not going to say it's the edema. It's not the edema. So definitely we have to use the term what? Extravascularly. Okay. Now, as far as the criteria of the edema is concerned over here, the accumulations of the fluid, if we say from here, for example, is the left heart from where we're getting a branch. This branch is supplying the within a tissues. For example, is the terminal portions of the branch of the artery. We can say over here this is the capillaries, and after that we are getting the drainage from the from the tissues, and that is getting in the terms of the venules. Ultimately, it is coming within the inferior vena cava, and ultimately it is going within the what? Right heart. So from the right heart, it again will see the blood that will be sent to the lungs. From the lungs, again the blood that will be circulated to the left heart. That means the left atrium first. Okay. Now, accumulations of the excessive fluid in tissue extravascularly. Definitely, this is the actual definitions of the edema. Now, the edema that can be seen extracellularly, also intracellularly. That we can say, if we see over here, the these are the cells, this is the body cavities. Okay. Now we can see the accumulations of the fluid. See the accumulations of the fluid, we can see intracellularly over here, or we can say also extracellularly, or within the interstitial spaces over here. So we can see the accumulations of the fluid within the cells or outside the cells also. Within the cavity, we have to consider extracellular, okay, because it's the outside the cell. So as far as the classification is concerned over here, we can classify the edema. It can be seen extracellular in the intercellular. So we can say extracellular edema and what? Intracellular edema. Intercellular edema. Now, whenever we are talking in terms of the accumulations of the fluid, definitely we need to know what is the normal volume distributions or the normal fluid distributions in the bodies. So if we see in this way, for example, there is an individual who is having the weight near about he is adult, he is having the weight 72 kilograms. So if we see the total body weight, if we see over here, from here try to understand the total body weight, approximately I am just taking in this way 72 kg for example. Now out of the total body weight, if we just divide it, we'll get the fluid, we'll get the total body fluid, or we can say the total body water, and then we'll get what? Lean body mass. So if we just divide it, we'll get the lean body mass, and we'll get also total body water. Total body water over here. Now, let's try to understand from here. If we just say about 72 gram, 60% will be the total volume, total body water. Okay, 60% of the total body weight, that will be the total body water. Okay, so over here, the 60% that will be the total body water of the total body weight. Okay, the rest 40% that will be the lean body mass over here in terms of the masses you can see over here. So if we say the total body water, we get over here around the 60% over here. Okay. Now if we say in this way that how much, if we just classify it further in terms of the intracellular water and extracellular water. So if you write it over here again, extracellular water will get 2/3 of the total body water. Will get 2/3 of total body water, and extracellular will get 1/3. Extracellular will get 1/3 of the total body water, and intracellular will get 2/3 of the total body water. 2/3 of the total body water. Now, whenever talking in terms of the extracellular water, at the time you have to understand in terms of the what? The blood that will come over within the blood that will also come over here. If we say over here in terms of the try to understand the fluid that is present within the interstitial space within the cavity, those type of the fluid that will be also calculated in terms of the water, that is 1/3 over here. Intercellular water, if we say intercellular water, that will be 2/3 of the total body water. Now intercellular means definitely within the cell, and if we say for example there is RBC, okay, let's draw it properly. Now within the RBC there is the presence of water molecules. Now these water molecules, that will be also considered as what? Intercellular water. That will also considered as what? Intercellular water or intercellular fluid. Okay, within the intercellular fluid we'll get the the fluid that is present within the blood cells, the fluid that is present within the normal parenchymal tissue or cells, whatever you can say over here. Okay. Now if we say it further, for example, okay, let's show it here. Within the intercellular total body water, here we'll get also the water where within the blood cells, and also the water within the normal cells over here. In a nutshell, we can say the fluid that is present within the cells. And what about the extracellular water? Out of the extracellular water, we will get around, if we just classify, if we just do the calculate about 72 kg, we will get here how much? 42. So 42 kg or the 42 liter over here, we can say that will be the total body water with respect to 72 kg and young adult man. Now here 42 we will get how much over here? We will get 28. So we will get 28 liters. That will be the intercellular total, you can say the total body water that is present where within the cell. And extracellular water will get how much over here? 14. We will get 14 liter. Out of 14 liter we will get 3.5 liters where within the plasma. Within the plasma we will get how much? Around 3.5 liter. Okay. Now this is the normal body, body volume distributions. I had to say, I think that's why I said it. Now we'll talk about what are the things we will see in terms of the pathological aspects, and what are the changes we will see in terms of the edema. Okay, basically if we say edema is also what? Is the cardinal sign in terms of the inflammation. It's the cardinal sign in terms of the inflammations over here. Okay. Now we'll talk about those things. Now see, as I said, the edema that can be extracellular, intracellular also. Now today we'll talk about the intracellular edema, then we'll go back to the extracellular edema. Now see, let's have some words about the extracellular edema. We can see the fluid accumulations within the what? Within the interstitial space, along with that what? Within the cavity, within the serum body cavity. If we write it over here, serum body cavity. So where will we get the serum body cavity? We'll get what? Definitely we'll get what? Where? Within the layers. Definitely try to understand from here. We can see in terms of the pericardium, in terms of the pleura, in terms of the peritoneum. So if we write it over here, the fluid that can get accumulated where? Within the pericardium. Within the pericardium, we can say. So whenever we get the accumulations of the fluid within the pericardium, this thing is known as what? Hydropericardium, or you can say pericardial effusion. So this thing is hydropericardium. Hydropericardium, or you can say pericardial effusion. Pericardial. Okay, let's write it clearly. Pericardial effusion. Okay. Now we can get also the accumulations of the fluid where within the another the serum body cavity, for example the pleura. So whenever we get the pleural fluid accumulations, this thing is known as pleural effusion. This thing is known as what? Pleural effusion. Pleural effusion, or another name for it we can say what? Hydrothorax. Okay, so we can say another name for it, hydrothorax. And we can also get the fluid accumulations within the peritoneum cavity. So whenever we get the fluid accumulations within the peritoneum cavity, this thing is known as what? Ascites. Yes, it's correct. So let me write with a different color for it. Okay, use this color. So whenever we will get the accumulations of the fluid within the peritoneum, at that time this thing known as what? Hydroperitoneum, or you can say ascites. So you can say these things, hydroperitoneum, or you can say the ascites. Okay. Now near about, if we get the half liter of the water that is getting accumulated within the peritoneum, that can be detectable. So from there, if we get the if we see the little amount of the water, for example half liter of the water that is getting accumulated within the peritoneum, that thing can be detectable as ascites. Okay, ascites. Now let's write over here. If we get near about half liter of water over here, then this thing can be detectable. Okay, so it's clear. Now whatever thing, for example if we get the accumulations of the fluid, if we get the accumulations of the fluid where, if we get the accumulations of the fluid within the microcirculations, what type of this thing is known as, if we get the accumulations of the fluid within the microcirculations, this thing is known as what? Hyperemia. Yes. So if we get the fluid accumulations within the microcirculations, for example is the tissue, and within the tissue if we get the microcirculations around the tissue, if we get the accumulations of the fluid near the tissue within the microcirculations, so if we write the water accumulations within the microcirculation, this thing is known as what? This thing is known as hyperemia. Another term for it, the congestions. Now if we just compare and contrast in between the hyperemia and congestions, how can we differentiate? Now try to understand. If we say in terms of the hyperemia, for example you are getting the dilations of the blood vessels over here, as a result the more amount of the blood that will come over within the microcirculation, as a result within the microcirculations the body volume that will be increased over here, we can say the fluid that will get increased. So here if we get, for example for the dilations, if we get the vascular dilations, at that time you can get the hyperemia. And for example for any region, if we get the congestions within, if we get for any kind of the region, if we get the congestions within the microcirculations, at the time the fluid that will be get accumulated where, that will be accumulated within the microcirculations, that will be not able to go where, outside of the microcirculation, because of having the obstructions. So if we see, you can see over here, if we get any kind of the obstructions over here, so if we get any kind of the obstructions, that can lead to the congestions within the microcirculation. Okay, hope it's clear. Now we'll talk about in details about the total focus. Basically try to understand and focus today in terms of the intracellular edema. I'll talk about the extracellular edema in the subsequent part, the next part. This is the part 1. Okay, so let's talk about intracellular edema. So intracellular edema means what can you understand from the term? Whenever we will get the swelling of the cell, that means within the cells the water accumulations. If we get the fluid accumulations within the cells, as a result we will see the swelling of the cell. Now this thing is known as intracellular edema. Now we need to understand now why the water that will come where within the cell, why it will be swelling. We will see the swelling nature of the cells. Okay, so let's focus on the intracellular edema. For that thing I need to erase some part. Which part should I erase? This thing important for you guys. So let's erase this part only. Now let's continue the what? Intracellular edema. So we'll go in detail about the intracellular edema. See, when you are talking in terms of the intracellular edema, try to understand from here that the accumulations of the fluid where within the, for example, I am just showing the cell, these cells I am representing from here to here, okay, within the tissue. So, for example, this is the cell, this is the cell. Now try to understand. In these cases, we will get the accumulations of the fluid, we will get the what? The accumulation of fluid within the cell. As a result, we will see the swelling of the cell. So whenever we get the swelling of the cells, this thing is known as edematous cells. Over here you can say the cells has developed edema. The cell has developed edema. What are the causes that can cause the intercellular edema? Now try to understand what do we know in each cells. In each cell there is a presence of sodium, potassium, ATPase pump. In each cell there is what? The presence of sodium, potassium, ATPase pump. So try to understand from here. In each cell there is a presence of sodium, potassium, ATPase pump. So by which we will get sodium, potassium, ATPase pump. By which it will just throw out the three molecule of the sodium ion, and it will take 2 potassium ion. As a result, we see there is the balance in between the extracellular environment and the intercellular environment as far as the electrolytes are concerned. Now, for any regions, if we get the sodium potassium pump is dysfunctional. So, if we get the sodium potassium pump is not functional, dysfunctional. If we write it over here, then whatever the thing we'll see, whenever it will be blocked, it is dysfunctional. So it is not functioning properly. As a result, we will see the sodium that will get accumulated within the cells. The sodium that will get accumulated, because whenever this pump is not working, there will be no transfer of the sodium from inside to outside. There will be no uptaking of potassium from outside of the cells to inside. As a result, within the cells, accumulations of the sodium ion. So whenever we will get accumulations of the sodium ion, this sodium will attract too much molecules of the outer molecules. It will attract what? Water molecules. It will attract the water molecules. So as a result, we will see within the cells, the water molecule will come and it will just make the cells swelling. It will make the cells swelling. Okay. So these are one regions. So if we get for any regions, if we get the sodium potassium pump is not working, this is the first condition. Second condition, for example, we are getting for the membrane problem. What do you know? Okay, let's draw the cells once again over here. Okay, is the cell membrane. This cell membrane for any regions, what do you know? Normally, what do you know? That the concentrations of the potassium, within the cell is more. We can consider the cell is the bag of potassium. And outside the cell, what is the concentrations? For the concentration of the sodium, the concentration of the calcium, that will be more. Okay, under normal circumstances, what do you know? This cell membrane is not permeable for the sodium. So this sodium that will repel back, this calcium will be repelled back without some conditions. Okay, under normal circumstances. Now what do you know? For any regions, if we get the damage of the cell membrane, if we get the damage on the cell membrane, so whatever problem we'll see, try to understand from here. If we get the damage on cell membrane, so whenever we get the damage of the cell membrane, these ions, that means the sodium, the calcium, okay, they can easily go away within the cells. So whenever we get the accumulations of sodium and the calcium within the cells, at that time they will attract the too much amount of the water molecules. So sodium, you can write in over here, the calcium and the sodium, they will go away within the cells. So when they will go within the cells, try to understand, water molecules will go. Whenever the water molecule will go over here, it will cause the swelling of the cell. It will cause the swelling of the cell. Now try to understand from the first region. One thing I have to say over here. See, whenever the sodium potassium pump, I am saying it's not working. Why it's not working? For one of the most common example. For example, if we see there is a development of the hypoxia. If we see the development of the hypoxia of the ischemia within the tissues. So within the cells, whatever the problem we see over here, these cells will not get enough amount of the oxygen. So if the oxygen is not available over there, try to understand there will be no productions of the ATP. So whenever the ATP productions will be lost over here, try to understand this pump, the sodium potassium ATPase pump, just to work, we need what? We need to utilize the ATP. So due to what? Whenever we see the deficiency of the ATP, this pump will be not able to work. As a result, we will get what? The accumulations of the sodium within the cells. So whenever we will get the accumulations of the sodium within the cell, as a result, we will get the attracting of the too much amount of the water molecules, and the cellular swelling we can see over there. Okay, so the first region over here, we can say the first region will get the hypoxia. The first region we can get over here the hypoxia. The second regions we got over here the cell membrane damage, cell membrane damage. Okay. Now I'll talk about the third things. Okay. The third regions we'll talk about over here. For example, the cell, there is these cells. For example, these cells suddenly, okay, for example, the tissues around it, suddenly develop the hyponatremia. Suddenly develop the hyponatremia. So whenever it will develop suddenly the hyponatremia, try to understand whenever it will develop the hyponatremia with respect to the cells, try to understand what I am saying. With respect to cells, these cells will be what? Hyperosmolar. Because under normal circumstances, if it is in the normal conditions, the within the cells and outside the cells, the electrolyte balance should be maintained over there. Now, if we see for any regions, for regardless the cause of the regions over here, if we see the extracellularly, if we see the development of the hyponatremia, definitely the cell that will be what? Hypernatremia. So definitely, with respect to the outside environment, the cells that will be what? Hyperosmolar. So in this case, see, we will get the cell that will be hyperosmolar. So whenever it will be hyperosmolar, definitely it will attract too much amount of the water molecules. As a result, we will see the edematous nature of the cells. So we will get the cellular swelling. So what are the reasons for it? I said in terms of the, try to understand intercellular edema. So if you write it over here clearly, togetherly. So first reason, so we got over here the hypoxia. The second reason, so we got over here the cell membrane damage. And the third reason I said over here, suddenly if we develop the what? Hyponatremia. So if we develop the hyponatremia, at that time we can see this type of problems. So this was all about in terms of the intracellular edema. That's not that much important. The most important on the extracellular edema, where we will see the the changes in between the we will get the some end of the mechanism. So we will get the sometimes of the disbalance in between the hydrostatic pressure and the oncotic pressures, and how the the cells are becoming more permeable. The endothelial cells will be more permeable, and why they will come during the inflammatory process. All these things, mechanisms related things, I'll talk about in the subsequent part of the videos when I'll talk about in terms of extracellular edema. So hope it's clear. If you don't, if you think if you don't get any point related to this whole video in terms of the intracellular edema, please let me know in the comment sections. I'll be there to help you guys. Thanks for watching. See you in the next video soon.